I've told my children, I have 3 children, 16, 13, and 9. The boy is the youngest, 9 years. For a long time, I didn't tell them what happens in the field. They just know I'm going to help people. That was all they knew. South Sudan, Sudan, whatever. They didn't know the extent of what I was going through. So one day we sat and we were just like, Dad, tell us stories about your work. I said, oh, yeah, by the way. So, South Sudan, you wake up and at night and there are gunshots the whole night. They're listening to me. And then I went to West Africa. You wake up and you see a patient. They're smiling. Tomorrow morning, they are not waking up. Or they see a patient who is almost dying. They wake up. They listen to that one. Then I talked about Ukraine. You know what? This one day, the explosion came and hit. And I was asleep and I woke up. They're like, hey, Dad, stop. Ngoja first. Wachia hapo. Okay. Tumekuheshimu, tumesikia. Don't tell us any more stories. The next one they came and said, Dad, those stories were so scary. We were telling them and laughing. But it stuck on their mind. They said it was so scary. They were dreaming the night, imagining what I was going through. So from that day, I filter even more what I say and when I say it. I say it, something happens today that was so bad. I say it like a month later. And I make it so either comical or very light so that they don't feel the weight of what I'm carrying. For them, it is not their weight to carry. The weight is mine to carry, not my family's, not my friends, it's mine to carry. So I always make sure I give just enough for people to know, hey, sio kuzuri sana. But at the same time, when I'm breaking, they shouldn't break with me. I break alone, I fix alone, they help me fix. So the family is one of my structures for coping. I know I will go home, hopefully, I will see them. The time I spend with them, I will spend and have fun and make memories before I go back. Right now, I'm in between contracts, so I love the period of between contracts because when I'm out of a job for 3-4 months, Nico leave. I spend all the time I can because during mission, I'm out for months, I come back for a week, maximum 2 weeks, if I'm able to do 2 weeks. So now I'm off for 3-4 months before the next mission. I spend that time as much as possible with them. So that's how we cope. Kagweria, anything you want to add?
For me, it's different.
Mm-hmm.
What I do looks like a hobby, which get carried away.
Mm-hmm.
So they don't understand why you need to do it. Yeah.
Mm-hmm.
They struggle with it to an extent. That was in the beginning.
Mm-hmm.
But with time, it became easier. The fact that my mom was a writer at home. But still, a bit of push and shove there. And then, now the view is but for me, I think I'm more affected than they are. I think, because when the road was so long, it really turns at your heart. Yeah, you should go to the toll it takes on you. You miss your bed, you miss your people. I think it affects me more. Actually, with the rise, I keep telling people it's not even the financial, it's
the emotions.
And it's a lot.
Yeah.
It really take a toll. It really also adversely affects, especially for women, active women. Let me use the word active. It doesn't have to be right. It really affects our marriages and how we date, and it's not easy to tell somebody, oh, I'm going to never see you. I wouldn't advise.
You wouldn't advise. That's a good one. Don't be like me. May I advise? If you can't, no, I don't. Yeah, I hear you.
How do you maintain your faith in humanity? I see myself in Gaza. Bombers just dropped from Israel, Tel Aviv, wherever. And we're seeing kids decapitated. And we're seeing mothers with blood all over. And we know that some human being across the border sent this bomb to decapitate people over here. Then when you see all that devastation, how do you maintain your faith in humanity?
Good question. Thank you very much. That's a question I've asked myself also. Why do I still do this when somebody else is doing this to others and doing it to us most probably? A lot of the times, what I do is remember what I am doing is helping, and I look at those around me who are supporting the people we're helping. And I realized, in as much as some people somewhere actually planned to kill or maim or destroy these people that we are helping, the rest of us are here. And I focus on those of us, my colleagues, my friends, who are doing what we are doing at that particular moment. That helps me block out the fact that indeed there are people who are so evil, they plan and actually execute the idea of injuring other people. That's number one. Number two is just reminding myself that humans have two sides, or there are two types of humans. There are the good ones, and then there are the not very good ones, the evil ones, who will plan and execute such a thing. So I count myself among the good ones, and I count those of us who are helping among the good ones. And I tell myself, there must be more of us who are good, either in the field or supporting from wherever they are, or just listening and trying to figure out how to give us that moral support. I count that we are more. The evil are not that much. So I help myself by that in terms of pushing myself to the next level and continuing to do what I do. But sometimes it's very, very devastating when you see it happening, especially as it has just happened. And you're not sure, will I even go? Because there are areas where people have been hit. You know they're injured, they need help, but you can't go immediately. And an emergency response should be within the shortest time possible. But again, if I go immediately, chances are then they finish me also. So then I'm useless to the people I'm going to help. So there's a balance of how soon can I help? That's the time when you feel all the pain of somebody actually launched a missile and killed these people or hurt these people, or somebody actually pulled the trigger and shot these people. That period of waiting to go and help is very messy. And it can break you because then you're not sure, should I even go? Or if I go, maybe I'll find the people who launched, some of them are there. So do I help them or leave them? And for me as a humanitarian and as a medical doctor, I help anybody I find. I block out the fact that this may have been the perpetrator in my mind, and I continue to support. So it's a tricky situation, I'll be honest. Yes.
Especially how you decide who's the people. Because at some point the Israelis were attacked. And obviously, if Gaza wasn't attacking, commensurate measures, then you would say the Israelis were the victims.
Yes.
The ones who needed help.
Exactly.
And the folks in Gaza then become the evil ones.
Yeah.
So now that Israel did what it did, then Gaza becomes the victim. Guys now considering Israel the aggressors, essentially, and the evil ones. So how do you strike that? How do you decide who's evil and who's not evil?
Good question. So as a humanitarian, I am, by the international humanitarian law, I am unbiased. So I do not have sides. I have my feelings, and I can, if I sat with you now off camera, I'll tell you who I believe would be the one who is wrong and who is right, and who should have stopped and who should not have stopped. But when I go into the field, I don't have sides. I go in, and whoever I find, I help. Whether it is the Israelis, whether it is the Gazans, whether it is the Russians, whether it is the Ukrainians, or even when we were struggling with people in Moyale and Ethiopia, and then the people are fighting among themselves, when I go into the field, I'm just going to help. I don't care who it is, I block it out completely. So one of the principles, even I live by, even before I became a humanitarian, is my work is to help, regardless. I've had to treat a known criminal who had just been shot by the police, but brought to the hospital. And there were patients around who were like, watch akufe. Because if he survives, he'll go terrorize us some more. But so in your mind, you're like, maybe, for the sake of humanity. But also maybe for the sake of humanity, I cannot do that. I cannot let somebody die as I am seeing. So I treated the person. So I don't know what he did after that. I block out the fact that he might go back and hurt more people. I'm hoping that the systems will take action and deal with them as they should. So that's where now the struggle sometimes comes. But the bottom line is I am expected to help everybody I find, regardless of what my opinions are. And that's why I don't air them, number one, what my personal opinions are. And number two, when I'm there, I don't have sides. Yeah.
How you are needing to advise governments?
Yes, that's part of what we do. We are part of policy and part of the advisory capacity as NGOs. When we go in, when I was in WHO, that was part of our job. So we advise the government we are working with at that particular moment in the country we are working. On a global level, WHO then advises at that global level the different countries and what they think should be done from a health perspective or from a humanitarian perspective. Advising is one thing. That advice being taken and implemented is a different thing. And many times we've seen that it advise a government and they do what they want because they're sovereign. We only advise. They're the ones who make the decision to actually put a policy in place. So we do our best and then wait and see. But whatever we are supposed to continue doing at that life-saving capacity, we continue doing it. Yeah.
My last question.
Yes.
What's your grounding philosophy? Something like charity for you to go through what you're going through. The motivation can't be money.
No.
It can't be something trivial. It has to be something really serious. For me to get out of here, go to Gaza, leave my children, whatever I'm grounding my philosophy. So just biblical perspective to what you're doing.
Mine would probably sound a bit mundane or a bit simple. It started when I was planning to go for the Ebola response. And I remember one thing that I told myself is that regardless of who it is that is suffering, if you cut each one of us, we all bleed red. That has always been my motto. We all bleed red. Whether you're black, you're white, you're green, you're orange, you're